So today's topic will be the gluteal region and the review of hip joint. Right. Already we have studied the uh, mm, important landmarks and the review of total lower limb. So today we'll see the gluteal region. Mainly, we'll focus on the functional anatomy of the lower limb and the clinical anatomy of the lower limb. Right. So the strong muscles and joints of the lower limb, they are adapted for the locomotion. No, which locomotion? That is your bipedal locomotion. Okay, and that conjuncted with the muscles of the trunk and that maintains the body's center of gravity. Right. So here just we'll see the lower limb muscles, how they accompany the uh, lower limb with origin, attachments, innervation, and action. So in this section, we'll see the some images over here. No, that is the topographic images. And first we'll discuss about the pelvic girdle over here. So here you can see this is the pelvic girdle. So this pelvic girdle, that means what? This includes the hip bone. No, here you'll find the right hip and the left hip. This hip, otherwise known as your coxal bone, right? Coxa or coxal bone, right? So the coxal bone or the hip bone is the both the side, and at the center you will find the sacrum, right? That forms the pelvic girdle or the bony pelvis. So about the detail about the bony pelvis, we have discussed earlier lectures. So here we'll see that how this pelvic girdle, that is related anatomically and functionally to the pelvis and to the lower limb. Okay, that we'll discuss over here. So here you can see this is the anterior view of the pelvic girdle along with the hip level over here. So here you can see the articulation at the sacroiliac joint and the pubic symphysis over here, that is supported strongly by the sacroiliac ligament and the sacrotuberous ligament and the sacrospinous ligament that we have discussed in our previous videos. So this ligaments and the articulations over here, that makes a framework that stabilizes this hip joint. So this uh, hip and the pelvic girdle that supports and encloses the viscera inside this pelvic girdle, and that transfers the weight, no, that from the trunk to the lower limb, right? And that forms the part of the hip joint also over here, and that provides the attachment sites for the lower limb muscles. So first we'll see the gluteal region muscles. So this is the image for the posterior view, where you will see this is the posterior view of the sacroiliac joint, and this is the hip joint over here. And here you will see the how the sacrum that is articulated over here, and the coccyx over here, and they how they mix the pelvic girdle and the gluteal region. So first we'll see the gluteal region. So gluteal region means that is the muscles that is present at the posterior part of this pelvic girdle, right? Or posterior or outer surface of the pelvic girdle, and it actually includes the buttock region over here, which overlies the posterior part of this pelvic girdle and the lateral part of the hip, or you can say the lateral part of the hip region, which covers the hip joint and extends as far anteriorly as the anterior superior iliac spine. Right. So this muscular compartment that you will see over here, that is known as the gluteal region, and that contains mainly the muscles that laterally rotate the hip. So here you can see all these are the muscles that help in lateral rotation. So here also you will see the superior gluteal, inferior gluteal, and the sciatic nerves over here, and you'll find the superior and inferior gluteal arteries and veins over here. No, so first we'll see the muscles, right? So here you can see the number one that I have mentioned over here. Uh, so this uh, this is actually represents some muscles, no? So these muscles are mainly, you know, that I have not mentioned over here the major muscles. That major muscles are your gluteus maximus muscle and the gluteus medius and the gluteus minimus muscle, right? So okay, so little bit I will give you some information about the gluteus maximus muscle, as you know it, but still I will give you some information that the origin of the gluteus maximus, that will be from the sacrum over here, the dorsal surface of the sacrum and the lateral part of the sacrum, and also the gluteus maximus takes origin from the iliac crest, right? Or you can say the ilium, mainly the gluteal surface of the ilium and the posterior part of the ilium. Then it also takes origin from the thoracolumbar fascia, and also it takes origin from the your ligament. Which ligament? That is sacrotuberous ligament, right? And this gluteus maximus muscle, that is just a very large maximum size muscle, and that comes downward and attaches. It is actually two fibers. Okay. Uh, the insertion of the gluteus maximus has two fibers. One will say the upper fiber, and one is your lower fiber. So upper fiber of the gluteal maximus muscle, or you can say the gluteus maximus muscle, that actually takes insertion at the iliotibial tract, right? So here you can see this is your iliotibial tract. It is very well known modified fascia, okay, to where this gluteus maximus muscle takes insertion, and the lower fiber of the gluteus maximus muscle, that actually comes downward and it attaches to the gluteal tuberosity, right? So here you just see that this gluteus maximus muscle that has the innervation from the spinal nerve L5 to S2. Okay, so that is, what is that? That is your sacral plexus. Okay, so that nerve will be known as your inferior gluteal nerve. Okay, so gluteus maximus muscle, that will be innervated by your L5 and S2, L5 to S2. Okay, and they are actually the part of your, what is that? Uh, Sacral plexus. Okay, and that nerve will come. That nerve will be your inferior gluteal nerve. Okay, and the root value of that will be L5 to S2. Okay, And if we'll see the action of this gluteus maximus muscle, then the entire muscle mainly helps in extends and externally rotates the hip in a which plane? In sagittal plane and in the coronal plane. Okay. So, but here if we'll see the details of this gluteus maximus action, mainly the upper fiber, which actually inserts to the what is that? Your iliotibial tract, that helps in abduction. Okay, but the lower fiber, which actually inserts at the gluteal tuberosity over here, okay, that helps in adduction. Okay, so it has two functions mainly, two individual function. One is your upper fiber, okay, that helps in abduction, abduction of hip, whereas the lower fiber, okay, that helps in adduction. Okay, because here you can see uh, the direction of fibers. No, so if this is your gluteus maximus muscle, right? So this is the gluteus maximus muscle. Okay, so if this muscle will contract, right, then the hip that will go in this way, right? So that is the abduction. But here you can see these fibers. If this is the fibers of gluteus maximus, but that is the lower fiber that attaches to the gluteal tuberosity over here. If this muscle will contract, okay, then what will happen? The hip that will move inward. No, so this is your adduction, adduction. But this movement will be your abduction, right? So this is about the gluteus maximus muscle. Okay, like that, if we'll see the mm, the gluteus medius muscle. So this gluteus medius muscle that also takes origin from the ilium, from the gluteal surface of the ilium. Okay, and mainly the gluteal surface that is just below to the what is that iliac crest over here. No, this is your iliac crest. Just below to it, from here you will find the gluteus medius muscle. Okay, origin, right? So this is the gluteus medius muscle origin. So it is taking origin no doubt from the iliac crest and from the anterior and posterior gluteal line, right? Here we'll find the anterior gluteal line, and here we'll find the posterior gluteal line, and here we'll find the inferior gluteal line, right? So from the anterior gluteal line, your gluteus maximus muscle. From the anterior to posterior gluteal line, you'll find the gluteus medius muscle, and from this posterior to inferior gluteal line, this region that gives origin to the gluteus minimus muscle. So this muscle, it actually attaches to the greater trochanter. Here you will see this is the greater trochanter of the femur. No, because here you will see the head of the femur over here. Right. This is the neck of the femur, and this is the greater trochanter of the femur. So the gluteus medius that uh, gives insertion to this greater trochanter of the femur, but at the lateral surface. Okay, at the lateral surface of the greater trochanter, right? And this gluteus medius muscle, it has also the innervation from the sacral plexus. Okay, but that is in form of your superior gluteal nerve. Okay, the gluteus maximus, that is inferior gluteal nerve, but the mm, uh, gluteus medius and the gluteus minimus also, right? They take nerve supply from the superior gluteal nerve. Okay, and its root value will be L4 region to S1 region. Okay, but the inferior gluteal nerve, that root value has L5 to S2. Okay, but the superior gluteal nerve root value will be L4 to S1. and like that you'll find the gluteus minimus muscle. Okay, I'll say action of the gluteus medius and minimus in a same time, because they have the common action. And the gluteus minimus muscle that also takes origin from this ilium, mainly the the gluteal surface of the ilium. Okay, and just below to the gluteus medius muscle, and it also uh, comes downward and gives insertion to the greater trochanter, but here mainly the anterolateral surface. Okay, the gluteus medius muscle that takes insertion at the lateral surface of the greater trochanter, but the gluteus minimus that takes insertion at the antero and the lateral surface. Okay, both on the anterolateral surface of the greater trochanter. And it has also the same innervation, that is the superior gluteal nerve. Okay, taking origin from the L4 to S1, but the action of this both these muscles, okay, that will be common. Okay, what is that? So entire muscles of this gluteus medius and the minimus muscle, if entire muscle will work, then abduction of the hip will be there, because the direction of fibers are like this, so once this muscle will contract, right, then the hip will move outwardly, so that will be the abduction. And this gluteus medius muscle actually it stabilizes the pelvis. Okay, because the tilting of the pelvis during the gait, no, that mainly the gluteus medius muscle helps. Okay, otherwise if the gluteus medius muscle will be paralyzed, then you can see those persons, those who have suffering from the hemiparesis, if they will walk, you'll see they will have the circumduction gait, okay, rather than the normal gait. So here this type of symptom is, that is known as a Trendlen box, okay, sign. So once the patient will walk, if the gluteus medius muscle of a particular side, suppose the left side muscle will be weakened, then to compensate that abduction movement of the hip, the patient will tilt to one side. No, so that tilting movement means tilt is strong to one side. No, so that is actually the Tendlon box test, you can say, through which you can identify whether the gluteus maximus, sorry, medius and minimus muscles are working or not. That you know already, but I will not discuss better. So here the anterior part of this gluteus medius muscle that actually helps mainly in flexion and what is that, in your internal rotation, right? All these muscles that you can see over here, these are the lateral rotator muscles. Okay, but the gluteus medius muscle, mainly the anterior fiber, and the gluteus minimus anterior fiber, they help in flexion and internal rotation. Okay, of the hip. Okay, but the posterior part, mainly the posterior part of the gluteus medius muscle and the minimus muscle, that helps in extension, no doubt, but though it is inserting to the posterior part of the femur, so if the posterior part of the gluteus medius muscle will contract, then the external rotation will be occur, right? So that means what? The gluteus medius and the minimus, if the anterior fiber means the insertion part, right? If the anterior fiber will be contracted, then the internal rotation and flexion will be there. But if the posterior fiber uh, that will contract, then the extension and the external rotation will occur. So this is about the gluteus maximus, medius, and minimus muscle. Like that, here we'll find the muscle that is the tensor fascial lata, right? So this tensor fascial lata actually it takes origin from the anterior superior iliac spine that you can observe over here, and it comes downward and it inserts at this iliotibial tract, right? At this point that you can observe, and this iliotibial tract and the tensor fascial lata they also innervated by the superior gluteal nerve, and its root value as I told you it is the L4 to S1. Okay, and the action of the tensor fascial lata that will be the mainly the flexion and the internal rotation. Okay, with it is combination with the gluteus medius and minimus muscle because they have the same innervation also. Okay, like that you will find the piriformis muscle. Okay, so here you can see the number 5 that here just we have mentioned. This is your piriformis muscle. Okay, so this piriformis muscle actually it takes origin from the ventral surface of the, if suppose this is the ventral surface of the sacrum, then you can see uh, the origin of the piriformis will be in E shape. Okay, this is actually the posterior view, but I am mentioning you the assuming, okay, is anterior view. Then you can see this is the, what is that, origin point of the piriformis muscle. Then this piriformis muscle that actually comes laterally and slightly downward, and it is just coming out of the, what is that, the pelvic cavity or the pelvic cavity. Then it comes towards the greater sciatic foramen, then it comes towards this, what is that, humor, right? And here this piriformis actually it attaches to the apex. This is the apex of the greater trochanter, no? So this is the piriformis muscle. Okay, so insertion of this piriformis muscle will be the apex of the greater trochanter of the femur, right? So this piriformis muscle, it is piriform shape, no? That's why it is piriformis muscle, and it is mainly innervated by the direct branches. Okay, the direct branches from the sacral plexus. From the sacral plexus. Okay, so what will be the root value? S1 and S2, right? S1 and S2. And as already you know about this piriformis action, no? Because this piriformis helps in external rotation, abduction, and extension of the hip joint, right? And also this piriformis that helps in stabilizing the hip joint, right? Then here you will see the number 6 that you can see over here, right? So this is actually the obturator internus muscle, right? So this obturator internus muscle, as already we have discussed about that thing, it takes origin from the outer margin, inner margin of the obturator foramen, okay, and or you can say inner surface of the obturator, what is that, foramen and the obturator membrane, and here it goes towards the lateral side, right? And it is just attaching to the uh, medial surface of your greater trochanter. No, as you can see over here, this is the fiber, right? And this fiber it is going towards the greater trochanter, and Here you can see this is your greater trochanter over here. This is the lateral surface, and this is the medial surface. This is the apex, right? And this is your posterior surface, and anteriorly you'll find the anterior surface, right? So this obturator internus muscle, that is uh, uh, actually what is that? So insertion will be the medial surface of your greater trochanter. No, like that here you will find the gemini muscles. No, here you will find the superior gemellus muscle, and here you will find the inferior gemellus muscle. Okay. So gemellus, the plural will be the gemelli, right? So these gemelli muscles, or you can say the gemellus superior, that you can observe over here, right? So this muscle, it takes origin from the ischial spine over here. No, so here you can see the ischial spine. Then here you can see the greater what is that? Sciatic notch, and here we'll see the lesser sciatic notch. So this is your ischial spine. So this superior gemellus, that takes origin from the ischial spine. Okay, whereas the inferior gemellus, that you can observe over here. Okay, and this takes origin from the ischial tuberosity. No, here you can see this whole is the ischial tuberosity, right? And here you'll see that these two muscles, okay, uh, they they actually joined with the obturator internus muscle. So if we will dissect the cadaver, you can see the three tendon-like structures are will be visible. Okay, so that will make the identification point for this three muscles: the superior gemellus, inferior gemellus, and in between that you will find the obturator internus muscle. Okay, so it all these three joining with the obturator internus tendon, okay, they actually inserts at the uh, medial surface of the greater trochanter. Okay, like that here you will find another muscle. That muscle you can see over here, the number 8. Okay, this is known as your quadratus femoris muscle. Okay, what is your, what is that? Quadratus, because it is quadrangular in shape, quadratus, and it is inserting to the femur, so it is quadratus femoris muscle. And this actually takes origin, here you can see, from the um, lateral border of your ischial tuberosity, and it is going straight away towards the intertrochanteric crest over here, right? Here you can see this whole is the intertrochanteric crest, no, and that you can find over here, because this is the lesser trochanter and this is a greater trochanter. In between that you'll find a crest over here, right? So at this intertrochanteric crest you'll find a tubercle over here. Okay, and this tubercle will be known as your quadratus tubercle. Okay, so this quadratus femoris, that actually takes insertion at the intertrochanteric crest of the femur, particularly to the what is that? Quadratus tubercle. Okay, and all these four muscles, what is that? Superior gemellus, obturator internus, inferior gemellus, and the quadratus femoris, all they actually takes not supply uh, from the direct branch of the sacral plexus, that is from L5 to S1. Okay, and that is, what is that? Nerve to quadratus femoris. Okay, that nerve will be the nerve to quadratus femoris. Okay, so here you will see that all these three muscles, that is your superior gemellus, obturator internus, and the inferior gemellus, all these three muscles, they help in external rotation. Okay, external rotation, abduction, Okay. Abduction and mainly the extension of the hip. Okay, extension of the hip means hip joint. Okay, depending on the joint's position, right? So like that, the quadratus femoris that you can see over here, this is actually helps in external rotation only, and the but here you can observe that when this muscle will contract, okay, the adduction will occur. Okay, when this muscle will contract, then adduction will be there, right? All these above three muscles, they helps in abduction. Okay, because you can see these three fibers, they are inserting to the greater trochanter superiorly, no? So if this muscle will contract, okay, then the hip will go in this way, no? So in this way means this part will go that way, no? So abduction will be there. So if this muscle will contract, okay, in this way, then what will happen? This lower part will go inward, no? So that means this whole part will go in this way. So this is the adduction, right? So this is all about the gluteal region muscles. No, so posteriorly, that structures passes between the pelvis and the gluteal region to this greater sciatic foramen. Mainly, that is most important. What are the structures that is passing through? What is that? This greater sciatic foramen that you can see over here. No, and it is actually covered by the what is that? The mm, ligament, no? Which ligament that is? Sacrotuberous ligament, right? So the sacrotuberous ligament that converts this greater sciatic nerve into foramen. Okay, and through which the piriformis muscle, the superior gluteal and inferior gluteal vessels, the superior gluteal and inferior gluteal nerve, the sciatic nerve, no, the pudendal nerve, and the internal pudendal vessels, and the posterior femoral cutaneous nerve, the lesser sciatic foramen also will find over there. So that also gives a passage to the uh, uh, what is that? The mm, the the nerves and the vessels that is mainly going towards the perineum. Okay, mainly they are the internal pudendal nerve, artery, and the vein. Okay, mainly the pudendal nerve and the tendon of your what is that? Obturator internus muscle, okay, that passes through the lesser sciatic foramen. Okay, but the greater sciatic foramen, mainly the piriformis muscle, superior and inferior gluteal artery, vein, and nerve, the sciatic nerve, and the pudendal nerve. Okay, along with the pudendal artery and the vein, right? And one nerve that is with the sciatic nerve that will pass downward, that will be your posterior femoral cutaneous nerve. Okay, so these structures, they are actually passes through this greater sciatic foramen. Okay, uh, like that, actually this gluteal region, that is very important area region for the intramuscular gluteal injections, no? Because intramuscular injections, they are commonly given in this gluteal region. The Here if you will see this region, so whole over this is your gluteal region. Okay, suppose this is your gluteal region, mainly by the gluteus maximus, minimus, and the medius. So you just divide into four parts over here. No, and you'll see. Sorry. Okay, you'll see this is your okay supero lateral. This is your supero. Sorry, superolateral. This is infero lateral. This is infero-medial, and this is supero-medial, right? So superomedial, you'll find the lumbosacral trunks, no? They are coming downward, so you cannot give injection; it will cause injury to that nerve. And inferomedial, that so many structures are passing through this greater sciatic foramen, so this is also dangerous site. Okay, and inferolaterally you'll find the hip region and the vessels over here. No, so it is also a dangerous site. But the superolateral site, that is the good area for the, mainly this is the site for the injection, right? So the superior lateral quadrant, no, because we are dividing this gluteal region into four quadrants, no. So this superior lateral quadrant, or above the line, no, that is connecting to the posterior superior iliac spine and the top of this greater trochanter, that is the safest site for the uh, what is that, for the injection, no, that avoid the large sciatic nerve and the gluteal vascular structures damage, right? Like that, you'll find the piriformis syndrome. No, all you know about this, because this is the sciatic nerve that normally passes through this what is that, greater sciatic foramen, right? So here you'll find, what is that, the sciatic nerve that will come downward, okay, and here you'll find the piriformis muscle also, right? So what happens here? uh, Mainly the what is that, sciatic nerve that passes inferior to the piriformis muscle, okay. So tightening or shortening of the muscles that can compress and irritate the sciatic nerve, okay, and that will cause the pain, numbness, paresthesia, tingling sensation, okay, in the buttocks region, and the posterior part of the thigh, because already I have told you that with the sciatic nerve, the posterior cutaneous nerve of thigh also running downward. Okay, that is also coming through this greater sciatic foramen. So compression of this piriformis muscle, that will also compress the sciatic nerve and the posterior cutaneous nerve of the thigh, or any spasm occurred, or any pathological events occur to this piriformis muscle, okay, that will cause pain at the buttock region and the posterior thigh region. In some cases, you will find that the sciatic nerve, or it's mainly the what is that, peroneal component, or you can say the common fibular component, that is compressed, okay. It passes through the muscles, through the piriformis muscle, and this type of what is that, symptoms or the problems is occurred, then we will call it as a piriformis syndrome. No, syndrome is group of problems, no. So this piriformis syndrome, that should be very well distinguished from this sciatica. No, in sciatica you will find the pain and the paresthesia that will result from the compression of the lumbar nerve. Okay, mainly the lumbar nerve roots due to the disc prolapse or by a herniated intervertebral disc. Okay, but the piriformis syndrome means if any what is that, spasm or any contraction, unnecessary contraction, fatigue of the piriformis muscle will be there, or any pathological events occur to this what is that, piriformis muscle, then also that will also irritate to the sciatic nerve, but mainly it irritates to the common, what is that, fibular nerve, or you can say the common peroneal nerve. Both are same name, used uh, to the one nerve, okay. So this common peroneal nerve will be maybe irritated, so the patient will feel, what is that, pain, paresthesia, tingling sensation, numbness, okay, mainly at the gluteal region, and that may also come downward towards the posterior compartment of the thigh, right? So this is all about the muscles of the gluteal region,